orientation toolkit.
Lovely. Good morning, everybody. So we've got 3 parts to cover on this one. So and the first part being sexual orientation. Next slide, please, Lauren. Thank you. Okay. So using our definition here from the NSPCC, so sexuality and sexual orientation is about who someone feels physically and emotionally attracted to. So this can be romantic or emotional attraction or both. And like lots of the other questions that we've talked about in the previous sessions, if you were there, sexual orientation is a legally protected characteristic under the Equality Act. And just a note here, so whilst younger people may want to express their sexual orientation, we're only routinely asking this to be asked for young people who are 16 years and over. Okay, so looking at our national and local context, so in the Birmingham census, so we had 6% of the Birmingham population identified as a non-heterosexual orientation. So we had 2.9% of males identified as gay or bisexual, 3.1% of females as lesbian or bisexual. So we've got there as well our kind of 9.4% who didn't provide an answer. It's been mentioned in the previous webinars. You know, there's always the option in amongst all of these questions to not provide an answer. In terms of how we compare to nationally, that 6% was lower than other core cities, but was similar to the national average. Okay, so why do we want to capture sexual orientation data? So on an individual level, so we're wanting to be providing respectful and inclusive care and to support people of different sexual identities and expressions, and of course tailoring interventions to meet those needs and to meet those preferences. We also want to make sure that we don't make any assumptions based on someone's gender or their appearance. At a service level, so we are aiming to identify and address any health issues or challenges amongst different sexual minority groups. It's also incredibly important for monitoring and evaluation of quality and effectiveness. So where there's any gaps, whether there are any barriers to particular groups and areas that we can improve, and also for the design and implementation of policies and programmes. What we do need to be mindful of is that there are significant health inequalities. So for lots of the LGBT community, there are higher rates of homelessness, domestic abuse, sexual violence, generally poorer health outcomes, substantially higher instances of mental health and drug and alcohol dependency. And these health inequalities can impact across the life course. Okay, so just moving on to the questions. So these questions reflect those that are asked in the census. So essentially kind of tested and validated questions. But again, we'll always kind of welcome your feedback on this. So we're asking if someone is straight or heterosexual, gay or lesbian, bisexual, and we have other sexual orientation, which is a free text box, and do not wish to answer. So capturing in the free text box is very important. Terminology is constantly evolving and changing, and there are a multitude of different sexual orientations that can be captured outside of the 3 there. Thanks, Lauren. Okay, so some of the specific issues that we need to consider when we're looking at this question. So make sure that we avoid confusion with gender identity. So we had that earlier webinar there. If you weren't at that webinar, as Lauren mentioned, there will be recordings of these, so it's something that you can catch up on. The responses that you capture may be dependent or maybe be biased towards perceived socially acceptable answers. So you may find that there is underrepresentation potentially amongst that kind of cohort of non-heterosexual service users, and that feeds into non-disclosure as well. So typically impacted by cultural sensitivity or acceptability, and the perceived confidentiality of what's being collected, and by stigma. Now, there's a potential option when you're collecting this data. So it's not necessarily all going to be kind of self-reported in terms of forms. So you do have that option depending on suitability or your type of service to collect information face to face. This type of question, being quite sensitive, may be impacted a little bit more if you're asking the questions face to face. You might have questions around the relevance of capturing this. And of course, there may also potentially be generational differences. So kind of younger service users, may be more open to disclosure or being happy to discuss their sexual orientation. Our older service users, kind of, again, that question around relevance really, potentially very different there. So just kind of be sensitive to the people that you serve, and to flag there that terminology is developing. So if someone's identity is one of those that isn't already captured there, then please use what the individual states. So it's not up to us to kind of decide what's valid and what isn't. It's very much about an individual self